Welcome. Hello. My name is Kim Meredith, CEO of the San Francisco General Hospital Foundation, and I'm delighted to welcome all of you here today to the Hearts Grant ceremony. Our foundation's mission is to support and fund patient care and innovation at Zuckerberg San Francisco General Hospital. Why? Because we believe in health equity and access to care for all. It's such an honor today to host today's ceremony, especially since this is my first Hearts Grant ceremony. While I know a lot of you were hoping that we could gather in person this year, reluctantly, we've had to go back into the virtual world, and we are very grateful for technology for giving us that opportunity. So ZSFG serves all San Franciscans and is focused on its most vulnerable citizens, with the vast majority of its patients on Medicaid, Medicare, or uninsured. And it's because of all of you on this call that we can provide the vital support to ZSFG during good times and during bad times and challenging times, such as during this pandemic. So thank you, thank you, thank you. Today's ceremony celebrates the outstanding work that takes place around the clock at Zuckerberg San Francisco General Hospital, as well as the steadfast commitment from providers and staff to deliver high quality, compassionate care for all. This afternoon, we'll hear brief remarks from Andrew McCullum, chair of our Hearts Grants Committee, and Dr. Susan Ehrlich, followed by the announcements of all of the 27 2021 grant recipients. So with that, I'm handing off to our Hearts Grant Chair and Board Member, Andrew McCullum. Thank you and welcome.
Thanks, Kim. Good afternoon, everyone. This is really a very special day for San Francisco General Hospital Foundation. Since 2004, the foundation has altogether funded nearly 550 Hearts Grants, totaling more than $13.5 million in support of the programs and initiatives at Zuckerberg San Francisco General. The Hearts Grant program is funded by the really very generous supporters of our annual Hearts in SF event and donors to the foundation's annual fund. And I'd like to just take a moment first to acknowledge our many funders and partners, some of whom are with us today on the call and some are not. But we are really incredibly grateful to their generosity to enable us to support these really transformative and innovative programs. I want to also personally thank all of the 44 applicants for working with us on this program and continuing to enhance the Hearts Grants, and for taking the time to submit such thoughtful and compelling proposals. This year, the foundation also introduced the option for both 2-year and 1-year funding of grants. And I think that has been a really successful change. I also wanted to just talk a little bit about the lens and priorities which we evaluated the grants. You know, we really tried to bring a focus to the Hearts Grants and really help people to bring proposals that really met these big audacious goals. The one first being care for all, equity and inclusion. And the way we describe this is that San Francisco General Hospital Foundation will strengthen the city's public safety net by nurturing cross-sector community partnerships and supporting Zuckerberg San Francisco General by integrating social determinants of health into clinical care. And we aim to apply the lens of equity in order to purposefully address those most impacted by structural inequities in our community and meeting them where they are. And then the second real focus area in transforming healthcare, innovation, and leadership, you know, it's where we invest in Zuckerberg San Francisco General's efforts to test, innovate, and incubate new and transformative models of care with an emphasis on whole person care, team-based approaches, and continuous quality improvement. You know, I was joined on this year's Hearts Grants Committee by many of my fellow foundation board members and representatives from the hospital, including Dr. Susan Ehrlich, Dr. Sue Carlisle, John Bell, Kimberly Good, Dr. Nita Ratana Wongsa, apologies, Matt Kinsella, Melissa Chadwick Dunn. Also key to this process were the following foundation staff: Kim Meredith, Jesse Lee, Melissa Moore, and Tiffany Liu. And I know I speak for the entire committee and really the rest of the San Francisco General Hospital Foundation in saying that we really got a huge amount of gratitude for the opportunity to learn more about the amazing work that you and your colleagues who submitted proposals do every day. It's work that has a deep and lasting impact on the hospital's patients and our community. And it is such a special honor to have this opportunity to recognize your passion and dedication, and to look forward to continuing to support your tireless and life-changing efforts. You know, for me personally, I have so much enjoyed being able to lead this committee. I feel like you really being able to see the innovative effort of all of the physicians and care providers and staff at the hospital has really been just so gratifying, and I so appreciate the opportunity to lead this committee and help to enable this amazing work. So with that, it's now my pleasure to welcome Dr. Susan Ehrlich, CEO of Zuckerberg San Francisco General and member of the board of directors at the foundation.
Thank you so much, Andrew. It's been such a pleasure to work with you over the years, and to just see how passionately you're involved in this process and lead it. It's really been a pleasure. And I want to thank everybody for joining us today. This is such a special time for me. In the 5 years I've been here, I've had the privilege of being involved with the Hearts Grants program every year. And what I've seen every year is what an amazing job our entire community does responding to the call for these grants, using your creativity, your expertise, your compassion to come up with these unbelievably inventive programs. And I've got to see the firsthand impact that these funds provide to our staff. I've seen the furniture and equipment, things less visible and just as important, like training and seed funding to help launch new programs and ideas. And it's always great seeing the ceremonial checks that we'll get to see in a minute, and that they are proudly posted around the organization. It's just a great innovative spirit that this program supports. And what the Hearts Grants all have in common is their lasting positive impact on providers, patients, and visitors, which of course helps all of us ensure a healthier San Francisco, even during a pandemic. I so greatly value the partnership between the hospital and the foundation. The support we receive from the foundation is truly remarkable and is unique, especially in the safety net hospital world across the United States. The foundation support goes well beyond the Hearts Grants program throughout the year and raises additional funding for a lot of different programs at the hospital. The most significant money that the foundation has raised for us heretofore is the $141 million that was raised for furniture, fixture, and equipment for Building 25. We would never have been able to open the hospital the way that we did without that support, or to be able to care for all of San Franciscans during this last year and a half of the pandemic. So Andrew and Kim, please accept my thanks to you and the entire San Francisco General Hospital Foundation board and staff for your efforts on behalf of the hospital every day. It is truly, truly appreciated.
Thank you.
To you, Kim, thank you.
Thank you, Susan. Thank you, Andrew, for your overview of the committee work, and thanks to all the committee members. And Susan, thank you for your leadership. I mean, we are so fortunate to have you as our extraordinary leaders. So thank you so much. Here we go. I think it's time for us to start announcing the grantees and the award winning groups. It was very competitive, as Andrew pointed out. We had well over 40 applications, and it was a very difficult choice under multiple meetings to make the decision for these awards of the 27 that we are going to share with you now. So Andrew, Susan, and I are going to divide it up a bit, and I'll start off here. So first award goes to Team Engagement to Improve Clinic Workflow, Patient Care, and Access to Care for $1,000. Congratulations. Next, let's celebrate Diabetes Education Materials for $1,268. Importantly, we want to honor culturally responsive pharmaceutical care for $2,000. And congratulations to BIPOC Hair Care for $2,500 award. Next, let's celebrate the Wet to Drying Improving Urinary Incontinence Care for $2,555. And thank you to our patient-centered approach to reduce colon surgery infections, and congratulations on their award for $3,687. Always wonderful to think about celebrating mothers and congratulating this group for their $5,000 award to the breastfeeding promoting incentives. Thank you to our Mental Health Rehabilitation Center Supportive Transitions team in giving them an award of $5,500. Thank you and congratulations. Additionally, let's thank the HIDRADENITIS SUPPURATIVA support group for their transformational work. Congratulations on your $6,350. And
Thank
then
you.
there we
Yeah.
go. Thank you.
Thank you, Kim. I get the honor of announcing the next group of grants. So first we have robotic pets for hospitalized older adults receiving $7,747. Messaging campaign for colorectal cancer screening receiving $8,025. Uncovering and addressing barriers to colon cancer care, receiving $8,100. Helmets for all in need, receiving $9,494. Reducing emergency department workplace violence, receiving $10,752. Improving recruitment and retention of BIPOC staff, receiving $12,000. AHP and Chill HIV Prevention Workshop Series, receiving $15,000. Hospitalized patient education and communication, receiving $16,000. And finally, community outreach, Spot a Stroke, receiving $22,629. And now I'd like to hand it off to Dr. Susan Ehrlich to announce the final group of grants.
Thank you, Andrew. I get the privilege of the next group. So sensory rooms and healing alternatives for $29,533. The BIPOC Nursing Externship Program for $30,000. The Pregnancy Pop-Up Village in the Bayview for $30,000. Care for immigrant patients seeking asylum, $30,000. Change SF and Laborin Kenya, $35,680. Reducing disparities in childhood obesity for $48,354. Code Lavender to our Sojourn chaplaincy for $48,500. Beyond medical care for $50,000. And last but not least, our largest award to the Improving Care for Patients with Substance Use Disorders, $58,326. Congratulations to all of our winners.
Thank you. Thank you, Susan, and thank you, Andrew, for sharing your group of winners. And thanks, and most importantly, congratulations to all of the 26 award winners. And to all of you who joined us today, thank you for your support of this life-changing and life-saving work that we are able to support at ZSFG. We are so appreciative of your ongoing support. In so many ways, it has really kept this community safe over the past year, and we look forward to many more years of this great work at the hospital, but of course through innovative programs through the Hearts Grants. So with that, congratulations to our winners. Thanks to all of you for joining us, and special thanks to Susan, Dr. Susan Ehrlich, and Andrew McCullum, our Hearts Grants Chair. And for all of you who would like to learn a little bit more, please go to our website, www.sfgh.org, and you can navigate your way into the Hearts Grants or other information you might enjoy seeing. Again, thank you so much.